All right. So good afternoon, everyone, and thank you so much for coming. My name is Blessing Akobundu, and I am a fifth-year PhD student in the Therapeutic Sciences program. Today, it is my pleasure to introduce you to the first webinar hosted by the Graduate African Student Organization, also referred to as GASO. This event is generally co-sponsored and supported by the following: the Africana Department, Sarah Doyle Center for Women and Gender, Africa Initiative at Wasson Institute, the Global Health Initiative, and Nelson Center for Entrepreneurship. So just a little bit about GASO. GASO is a newly formed graduate student organization that aims to create an inclusive space and community that provides a feeling of home away from home for African graduate students at Brown, while also engaging the broader Brown community on African-centered discourse. To meet this goal, GASO has launched a series of webinars where we invite speakers from the continent to share their work and diverse perspectives. Today's webinar, that is titled Data, Health, and Technology, Tackling Blood Shortages in Nigeria and Kenya, features Temie Giwa-Tubosun, who will spend some time sharing her work, which intersects data and technology to deliver public health solutions for patients. This event will be moderated by Brown's own Nancy Nkoudou, a current master's student in the global public health. Nancy's passion for healthcare work involves multi-dimensional approaches to health and wellness promotion for birthing populations. Throughout her education, she has spent substantial time in global and domestic clinical research settings, learning about avenues to provide healthcare within resource-limited communities. And as a certified interdisciplinary doula, Nancy's work involves improving birth outcomes by empowering birthing people and their families through holistic, culturally relevant, and evidence-based intervention. And with that, I am pleased to hand it over to our moderator, Nancy. And before I do that, before I forget, we will be monitoring our Q&A session throughout the event. So please feel free to leave your questions for our speaker there, and we'll get to as many as we can in the course of the event. And with that, Nancy, please take it away.
Thank you so much, Blessing, and welcome everyone to today's seminar, Data, Health, and Technology, Tackling Blood Shortages in Kenya and Nigeria. My name is Nancy Nkoudou, and today I have the pleasure to moderate a conversation with our speaker, Temie Giwa-Tubosun. Temie is the founder and group CEO of LifeBank, Africa's healthcare supply engine, whose company helps hospitals access essential medical supplies and delivers them in the right condition and on time for those in need. Since its beginning, LifeBank has saved over 10,000 lives and counting. Temie studied international public management from the Middlebury Institute of International Studies. She has over 10 years of health management experience with the Department for International Development, World Health Organization, United Nations Development Program, and the Lagos State government. Over the years, Temie has accumulated several international recognitions and awards. Among them, in 2014, the BBC listed her as one of the 100 women, changing the world. She was also recognized as an African Innovator by Quartz and the World Economic Forum. Recently, in 2020, she was awarded the Global Citizen Prize for Business Leader for her work in addressing blood shortages in Nigeria and LifeBanks work during the COVID pandemic. Everyone, please join me in welcoming Temie Giwa-Tubosun.
Thank you so much, Nancy. Thank you everyone for having me. I'm so glad to be here today. All right. So what I'm going to be talking about today is tackling blood shortage in Nigeria and Kenya, and basically telling the story of LifeBank. As Nancy graciously said when she was introducing me, I am many things. First, but not the most important, is I am the group CEO of LifeBank. LifeBank is a medical distribution company, a medical supply chain business, helping to transform the health system across Africa. We have big dreams, and I'm going to tell you about how we achieve those dreams and how we'll continue growing into the future. But there's still many more parts of me. I'm a cook. I love to cook, and I'm a very experimental cook. So I cook dishes from all over the world. I have a dog. I'm a dog mom, and I'm a human mom too. I have 2 children, and of course, there's Flash here, my favorite gentleman, who's a very good boy. I also like traveling. Here I am on the screen in Kenya, visiting some of our offices across Kenya, but also getting some time to go visit some of my friends. So how did I get here? Like many of you, I started my life in Africa. I was born to Nigerian parents in Southwest Nigeria. And my parents moved when I was a teenager to the United States. We happened to have moved to Minnesota, where I went to high school, finished high school, went to college. And then I was very tired of the cold and moved over to California to finish graduate school. My big dream was to become, to be quite honest, the Director General of the United Nations. I was completely obsessed with it. That sort of guided the kind of choices I made for my master's. I went to an international university, graduate school, really training people for international careers. Our school typically encouraged us to go back to Africa or to go back to developing countries to test some of the theories we had learned in year 1 during the summer between year 1 and year 2. I'm sure your school does something similar. It was this sort of summer break on the field that got me thinking about healthcare more seriously. I was sent to Kano, which is northwest Nigeria. Is a very large city, one of the top largest city in Nigeria. It is located in the northwestern region of the country. It's a quite big city, but I went there and focused on the villages surrounding the city. I had an experience around the poor healthcare on the continent and the consequences on the lives of women, particularly women who are poor and women who live in very rural areas. While doing some village work, going from household to household during this gap, during this summertime and summer work time, I met a young lady who had been in childbirth for a couple of days. She had been, in labor for about 2.5 days, and she was clearly in trouble, so was the baby. And the village at the time did not have the resources to get her the emergency C-section she needed, and everyone was waiting for her to die. I remember being taken by this story and having somewhat of a come to Jesus moment, thinking about how lucky I was and my responsibility to women like Aisha. So this is where this journey began. When I moved back to California to complete my grad school, I completely changed my major to healthcare. I gave up my dream to be the Secretary General. I knew that I was now going to dedicate my entire career to the health system on the continent, specifically helping women. I have one belief in my life, and I think it's probably one of the strongest beliefs that I've ever had. And I got that belief in that moment, in that village, in Kano, many years ago. I believe no woman should die while giving birth. I think it's even worse when she dies from a problem that can be easily solved. And as I tell you, every day, 556 African women die from postpartum hemorrhage. It is not a very popular problem. It is not like HIV/AIDS, right? Those of you in public health know how, obsessed the world was with HIV/AIDS. It is not polio, right? It is not malaria, right? It is not COVID, but it is a very catastrophic global health problem that affects the most vulnerable members of our community, women. And because it's a problem that affects women, it has been ignored decade after decade after decade. It had become something that the world had accepted, that women would simply bleed to death after birth. What really struck me as unacceptable was the fact that WHO came out a couple of years back and said, if we simply moved blood into the hospital where these women give birth, we could save 8 out of 10. That's 8 out of 10. And I thought those were great odds. Those were odds I could dedicate my life to. Those are odds that I could really, really focus the rest of my career to. I remember learning that fact and feeling like completely taken over and obsessed with building a system that would ensure that blood is in the hospital when these women give birth. So immediately I thought, well, the problem has to be getting more blood, right? Women need, women were dying. Of course, you just need to get blood to them, right? And what is the best way to get blood to them? To get young people, very similar to you guys, people in universities, to give blood, right? Commit to giving blood. I thought that only about 8% of Nigerians donate blood freely, and 80% of those who donate blood donate specifically to their relatives. And this is not a Nigerian problem, it is an African problem, right? And it's actually a problem in developing countries. So I thought that was it. So I started working. I had a full-time job at the time, but I spent my holidays, my weekends building this NGO. Figure out, the idea for this NGO also came during the bombing of the United Nations building in Abuja in 2011. By 2012, I started 1% Project, and I dedicated a lot of my time there. But what was the movement from Nigeria, from 1% Project to LifeBank? It was a very simple, day. I spent it was a weekend, so I had a bit of free time. I went to talk to, at the time, I would go to every single person who has anything to do with blood and beg them to talk to me. So that was what I was doing on a Friday afternoon in a blood bank somewhere in the mainland of Lagos. And the blood bank said something that changed my life. He said, oh, I said, do you need more blood? Do you need more blood donors? And he mentioned to me, no, my team are going to the incinerator to discard this blood. There was about 8 bags of blood in a carrier package. And I was so shocked. I said, so why are you discarding blood? He said, blood has a short shelf life. If I don't have a taker within 6 weeks of getting this blood, I am going to have to discard it. I was really taken aback by this particular system where you had a shortage with people dying and a surplus with blood being discarded. And I thought we could build a tech platform to connect the blood donors, right, or the blood banks to the hospitals who serve our patients. And that's where LifeBank was born, right? I knew that to build this kind of system, I needed capital because it would be very capital intensive to build a distribution system, to build a marketplace, to connect hospitals and blood banks. So I decided that we must morph from an NGO to a business operating within the startup dynamic. So I launched LifeBank, and this was about 6 years ago, and the journey started. So what does LifeBank do? I think we mentioned data earlier. The first thing we do is get inventory information from blood banks. We want to know what stock blood banks have. And as we speak today, we work with over 150 blood banks across 3 countries and 13 cities. We have a system that knows where every bag of blood is in a particular community. We use our data to better match the supply that's available to the demand. And when there is not enough supply, that data is able to connect blood donors to the blood banks who can collect the blood. So first is an inventory system in a marketplace dynamic. Then hospitals come and there's a marketplace where they place their order. Say, I need 5 bags of blood. I have a delivery tomorrow. I don't know if this woman will bleed, so bring 2 bags of blood so it's ready for her. And this is how we built the business. So first is technology first, data first, but also human beings are physical people, right? It's not just technology. These are physical products that must be moved to the hospitals. So that required a cold chain distribution system that can reach the hospital very, very quickly. In the beginning, we started with just bikes, motorcycles that can get in and out of traffic in big cities. And we're able to connect to the hospitals within a couple of minutes. So about 45 minutes to 55 minutes, using a combination of location mapping technology and our distribution shops. We have moved over 20,000 bags of blood to hospitals across the 13 cities and 13 communities where we work. And for us, we now started thinking, once we figure out the blood business, we thought, well, this innovation can be expanded to other products needed within the hospital, which brings us to our oxygen business. I like to say that we started oxygen way before the pandemic, way before people knew that oxygen was going to become a significant part of the health system of responding to COVID. We started our oxygen distribution business in 2019. And this story actually started, these products actually started with a story. In 2019, early in 2019, I read a story of a doctor in a hospital in Kogi State, Nigeria. Dr. Rosemary was a consultant physician. Those of you who understand the health sector on the continent understand that consultants are the big fish in the hospital system. They are the most senior medical professionals in a hospital. She had worked for many years in this particular institution. And although she was trained outside Nigeria and outside the continent of Africa, she came back ready to give back. But we had a problem. She was asthmatic. She had an asthma attack one day in the hospital where she worked. The hospital could not find the oxygen she desperately needed. Dr. Rosemary was a mother. She was a hard worker. She was a leader in our community, and she died. She had the resources and she died just because oxygen was not available. I remember feeling deeply committed to stories like that of Dr. Rosemary and thinking that something must be done. So again, we went out there and innovated. We used data and technology and distribution to build a supply chain system for medical oxygen. This supply chain came in very handy during the COVID pandemic. We were able to step in and distribute over 2,000 cylinders of oxygen to patients who desperately needed to breathe. And at the end of, right before 2020 and 2021 ended, we launched our own first oxygen plant. It is a smart plant that uses data to better match the demand in the community where the plant operates to the production level of that particular plant. So we like to call it a smart plant. But we didn't want to stop there. This particular product that we launched after oxygen actually did not start with a story like all of other products that LifeBank has typically starts. This one started from a conversation with the hospital. The hospital desperately needed PPE. The hospital served COVID patients, and the prices of PPE had gone up. The hospital called me and wondered if we could step in and help them build a better system for procuring emergency PPEs and other consumables. So the third product that LifeBank launched in 2021 is a product called StockBank. For us, the goal of StockBank is to decrease infection rates in our hospitals because there is a significant amount of hospital infection that affects not just the patients, but also the health workers. For us, that was operating in Nigeria was not the end. By the end of 2021, we were operating across 9 cities in Nigeria. but we wanted to do more. So we decided to expand over to Kenya. And for us, we knew that there was so much impact we could have around the blood, the oxygen, and the consumables PPE and environment for the people of Kenya. We have done so much, we have innovated. And for us, we have saved over 600 lives since we launched in Kenya just a few quarters ago. So where are we going with this? We like to go places. We like at LifeBank to say, we say at LifeBank, we like to do hard things. We want to focus on the most difficult problem and solve it. We believe that this is how we add value, and this is how we extract value. In 2021, late 2020, we finally launched in our last region of Nigeria, which is Northeast Nigeria. Some of you must have heard about the Chibok girls. The Chibok girls are from a state called Middlebury. Middlebury is in Northeast Nigeria. We wanted to launch in Middlebury to show that you can have a distribution system that can reach the very last mile. Imagine a Chibok girl needing to have a baby and in a local hospital and dying because of lack of blood. We thought it was not acceptable. So I made it clear to my team that we needed to get to Middlebury. And I'm so excited to tell you that we are now a fully pan-Nigerian business, working in Kenya, working in Ethiopia to rescue the most vulnerable women across our community. For us, it's not enough to just drive impact. We must also get to scale. For us in the future, we want to save 1 million lives, right? We want to rescue 1 million people. And for every order we fulfill, for every call we get, for every tap of our marketplace hospitals make, we get closer and closer and closer to our dream. Data is critical, technology is critical, multimodal distribution is absolutely essential. LifeBank is data first. Our marketplace is a data-driven marketplace to better match supply to demand. We build technology, we have a full stack tech team. We actually consider ourselves a tech team first, a tech company first, as opposed to a healthcare company, right? We build technology daily to make it easy for our hospitals to serve their patients. We innovate on behalf of our patients through the hospitals who serve them. For us at LifeBank, we believe that technology for the continent needs to be a combination of high technology, but very accessible system. So for example, our hospitals are able to use blockchain. They're able to use technology like data science, data analytics platform, but they engage with this high technology with SMS, with USSD. This combination of easy access and high technology allows us to build a new paradigm of how to build technology on the continent. For us, we deliver using bikes, using trucks, using tricycles, and sometimes using boats. But the future looks to us like delivering with drones. I was talking recently yesterday to a team out in New York City, and we were talking about how drones will allow us to reduce our fossil fuel, our dependence on fossil fuel. It would help us protect the environment as we protect our people. So the next few months, the next few quarters, look out, you're gonna be hearing about LifeBank taking to the skies and delivering using drones. For us, we want to change the narrative. All of the 150 amazing people who work at LifeBank are all Africans. We are so proud of our team. We are proud of the work we do. And we believe that with the success of LifeBank, we are going to be able to show the world that young Africans can come together, can band together and solve entrenched problems in our own community, and show the world that yes, we can, that we can be the heroes of our own stories, that we don't need anyone to come and help us, come and rescue us, that we're not going to be quiet and wait for rescuers, that we can do the work ourselves, as long as we're willing to be innovative, as long as we're willing to build partnerships, and as long as we're building systems to ensure commerce happens on our platform. For us, the future looks like operating across the entire continent. We want to be present in every single African country that still has this problem. We want to rescue every single woman across this continent to ensure she does not die while bringing life. We want to ensure that every single child who has pneumonia or any condition that requires oxygen gets access to the oxygen that they need. We want to ensure that every health worker is protected and every patient is protected against hospital infections. We have big dreams, and for us, we're always looking for people to join us. So my last speech is, should you be interested in the work that we do at LifeBank, I ask you to contact me and let me know how you would like to help us and how you like to help us grow. Thank you so much, and I'll pause here for questions.
Thank you so much, Temie, for this wonderful, wonderful, wonderful presentation. It's incredibly inspiring, more than I imagined. And so as you said, we'll be moving on to the moderated questions. Just as a reminder to our audience members, if you develop questions, please feel free to send them in the Q&A. It looks like there's one there right now, and we will answer those after this moderated conversation. Again, thank you so much, Temie. So the questions touch on various disciplines, and so we're trying to get questions answered for different people in the audience. So that's kind of the format of how the questions will be asked. So to start off, this is a personal question that I have. So as an African living in Africa, working to solve African problems, what is your advice to those in the audience, including myself, who want to give back to the continent, but are still struggling to find their niche, their duty, or even their problem?
That's a powerful question. I don't know if I have answers to it. I am very lucky to have found my life's work when I was 26 years old. I remember feeling deeply touched by the story of the community where I worked. And I knew then and there, in that moment, that I'd found my life's work. And I must tell you, it took me very many years before I moved back to Nigeria. And it took me many years before I could start, right? So for me, I think when we listen to people who are maybe somewhat successful in their lives, there's a sense that, oh, I gotta figure it out. But for me, I think life only makes sense in hindsight. When I tell my story, it seems that everything worked perfectly. But it's important for me to show that, no, it wasn't really always linear and perfect, and I was just growing and everything went well, right? There were times where I had to move forward and move back before I could find my way to the solution. But for me, I think what is most important is to check in with yourself and find the problem that makes you most feel angry. I'll say that again. Find the problem that makes you feel the most angry, right? For me, it was women dying in childbirth. In fact, at the time, I was not even a mother myself, right? But I just felt that it was an injustice, that only this gender had to face this danger, right? And I felt like I had something to prove to the world. I found a solution and I was focused on solving it. And I think the way out, and the way, particularly if you don't know now, is what makes you feel angry? What are the injustices that you see across our continent that you feel it is wrong? That you wake up every day and you think about it. I couldn't stop thinking about women in childbirth, even though I had no idea what women in childbirth felt. But I was so taken by this problem. I knew then and there that I'd found my life's work. So for me, I think, I don't think it is, for me, I don't see this as you need to find what makes you excited or what makes you happy. I think for me is what makes me upset the most, and what are the problems that makes me most concerned. And I think that is the answer that could work if you're like me.
Thank you so much, Temie, for this response. As you were responding to this question, it made me think of a couple of other interviews that I'd watched that you've done. And in those interviews, you'd mentioned a personal experience that you'd had with childbirth. And as I work with birthing populations, so this component of LifeBank is particularly interesting to me. So I was wondering if you could maybe talk a little bit more about that personal experience in childbirth and how it served to fuel the anger that you saw, the injustice that you saw with postpartum hemorrhage, or just birth outcomes in general?
Thank you. That's a great question. I think that a few years after I had this experience in Kano, I became a mother myself, right? Between the time that I became a mother and the time that I had this experience, it was an intellectual passion, right? I knew this was what I was going to do, but it was something that I was supposed to do professionally, right? This was going to be my profession. It wasn't personal. It was something that is intellectual, and it was something that I wanted to try to solve in a systemic way. One thing that I didn't mention earlier, it was as soon as I arrived back to California, I packed my bags again and went to Switzerland, to the World Health Organization, to Geneva, to work for a few years, right? But then after that process, I became a mom myself. And the exact same situation happened to me, but I was very lucky to be in the United States. I was very lucky to be in a hospital that had access to all the supplies that I needed. And both me and my son survived. And I'm very confident that if we had been in a different country, on a different continent, that one of us may not have survived, or maybe both of us, because it was a very, very difficult birth. And I think what that did for me was made this particular problem a personal problem, right? It became deeply personal. This particular problem became deeply personal to me. I knew then and there that, I already knew that this was my life's work, but at this point, it took over my entire life, right? I quit a very great job, right? And I started LifeBank shortly after.
Thank you. In a previous response, you'd mentioned that there was a delay between you moving back to Nigeria and actually starting LifeBank. And in a previous interview with BBC, you mentioned the corruption within the Nigeria government and the way in which it bleeds into the health sector contributes to many of the public health issues that you see, for example, mortality for preventable causes. So can you talk a little bit more about navigating the Nigerian public democracy as a private company?
Where do we start? And it's not just Nigeria. I deal with 3 African governments, and it's the same, right? For us, our model is not to work with governments, right? We're a B2B. We work with private health sector players across the continent. So in Nigeria, in Kenya, in Ethiopia, there are many millions, right? A couple of 100,000 of private hospitals who serve different parts of the population. You have the big fancy ones, you have the small class, middle class ones, and then you have the ones in urban slums who serve working poor, right? And for us, we wanted to expand and focus on those hospitals and prove our model first. There are many, innovators who maybe they meet some commissioner guy and, they move back, they want to build a big business and they want to focus on governments and they're disappointed. But early on, knowing how governments could tend to operate, and I didn't want a situation where we were reliant on someone's goodwill, right? And now, funny enough, governments then now come to us and they want us to sign up, they want to sign us. It's not a pull thing, it's a push thing. They come to us, they call us, they take us through, normal public bidding, and we win bids and we start serving governments. We recently signed an agreement with Yobe State government. So for me, I think one of the things we did well earlier on is to prove our model with private sector players. Once that had been proven, we built a business that has been growing, doubling revenue year on year since 2016, right? And we have not stopped. We're expanding, we're scaling constantly. So governments see that and like, wow, I still have this problem in my hospitals, in my health systems, in the hospital chains that I operate. Let me get LifeBank in to solve this problem for me. And for me, I think that's what has worked for us, right? Private first, and then once we've proven that model in the private sector, government is now coming to us, which allows us to scale faster. Because governments, as you all know, as you may know, governments, deliver about 60% of care across Africa. So we can't ignore them, but we didn't focus on them. And once we proved our model, they came to us. Thank you.
Thank you for clarifying this. I think that was an important point to make. So I'm curious now about how you all at LifeBank acquire funding, financing, and navigating the various markets, right? You mentioned working in Nigeria, Kenya, and Ethiopia, so I can imagine that it's incredibly complex, finding investors and funding streams. So could you talk a little bit more about how LifeBank is funded?
So LifeBank is, startup. We raise rounds like most startups. We tend to be quiet about the rounds we are raising because, like we said, governments, right? Governments will government. And for us, it's difficult to raise financing as an African business, right? As any business, right? It's very difficult. Raising financing is not always easy, right? As an African startup, it's even worse, right? Because you face devaluation, there are regulatory risk. The communities you serve are not there's not a lot of disposable income. There's a lot of poverty in the community that we serve. So it's quite a difficult environment, right? And of course, you're also a healthcare business, right? One of the things that are different about healthcare businesses is while they don't, healthcare businesses rarely die, right? Healthcare startups rarely fail, but it takes a long time for them to get to scale, right? So healthcare businesses are not very similar to, say, fintech that is doubling, valuation every 5 months, right? But typically we're very durable, right? It is a marathon for us and not a sprint, right? And I think that is a very peculiar, consequence of a healthcare business, right? However, it's also even difficult to raise financing as a woman-led startup, right? As a sole woman-led startup, right? I am a sole founder, I don't have co-founders, and that adds a different, environment for my funding landscape as well. So that combination is quite difficult, right? But we've also seen some success. We've raised about 4 rounds since inception, right? And those rounds have powered our expansion and our scale, right? So for me, what has been the answer? We focus on finding the right relationship with the right investor, right? So I don't raise the way other people raise, where they talk to millions of people, rinse and repeat, rinse and repeat. I'm not structured that way. For me, my style is to build long relationships with potential investor over years and years and years. And they see how I operate and how I work and how I scale the business. And they are often interested in helping us grow. So for me, that is my style, right? There are other ways, right? There are other models of fundraising. For me personally and for LifeBank, our style is to build very strong relationships with potential investors where there's a match in values for LifeBank and for that investor, right? It would be, for me, we're a dual bottom line startup. We're a high growth, high scale startup, but we still have double bottom line. We care about impact. We care about saving lives. We care about our patients. So any investor who does not share that value will probably not be a good fit for LifeBank. So it's very critical for me. And if you're running a business very similar, if you're looking to be part of a business that's similar to LifeBank, to be aware of that, to make sure that you're finding investors where there's shared values.
Thank you so much for your response. I have one more question to ask, and then we'll open it up for audience questions. And my question is a little bit more general. What would you say has been the most fulfilling experience thus far? We know that 10,000 lives have been made. We know the numbers. but I'm just interested on maybe something a little less quantitative that you can say has been the most fulfilling experience with LifeBank thus far.
Actually, I want to say every day is fulfilling, but literally it is, right? At least once a week, I get a call from a patient that we happen to have helped and that somehow they found my number. They often pray for me, right? And, I have, calls that I've saved on my phone where people are just praying for me, right? And for me, it's incredibly powerful, right? Because the reason they do that, they find time out of their time and they're like, we're going to call this person and thank her for the work that she does. And that, I think, is incredibly fulfilling, right? When I get to feel, as leaders, often sometimes I do, I have to recruit, I have to raise financing, I have to, hire people and fire people. And those kind of work get me away from the impact. But when the moments where I get to connect again with the impact of what LifeBank does, gets to be incredibly fulfilling. In fact, I had this last week. And the prayers was incredible. And it was a very tough week last week. And getting that prayer just made everything good again. So for me, the most fulfilling is when I get those calls where people are so grateful, they're so thankful for the work that we do.
That's beautiful. Thank you so much, Temie. So now I'm going to move on to the audience questions. And I will start off with the first one. This one seems to be a clarification question, and I'll read exactly as it was written. Thank you so much for your great presentation. For an initiative like this, I'm sure logistics management is an important part of it. Can you please help me walk through a scenario? Say I learned that someone at a health center that is close to a hospital you work, for example, needs blood. This person just wants to better understand how different pieces of the LifeBank process work together, the people, the vehicles, coordination across different health facilities, etc. Thank you so much, audience participant, for your question, and feel free to answer to me.
All right, that's a great question, and it's one of my favorite things to describe. Everything starts before the patient actually needs blood. The process starts with when we have a relationship, we build a relationship with the hospital. Then it goes to vendors, right? We work with over 150 blood banks. We ourselves are not blood banks, right? We are not, for the most part, oxygen manufacturers, or we don't create PPEs, right? So we're a connector, we're a marketplace, Amazon, if you will, right? So what we do is we get inventory information from our vendors. And this is when the process starts, right? For us to be able to deliver on time, sometimes less than 30 minutes, right? We need to first know where the product is, right? So that inventory information is absolutely essential, right? Then hospitals come in and say, I'm a doctor. Let's say you're a patient, you're in a hospital like you described, and the patient needs blood, right? Hospitals use, there's an application they can download, and using touch, they place their order. So let's say they need 2 bags of O positive blood. Once the order comes in, we have a system, right? Our brain, if you will, that matches the inventory information with the demand that the hospitals have placed and combines it. Once the order has been created, right? We've matched the request to the inventory, then it is sent to the phone, again, technology, of the actual medical dispatch rider. The medical dispatch rider gets their bike in place, or if it's their truck, or if it's their tricycles, or if it's the boats, and they go straight to the vendor, they pick up the product, and they go deliver to the hospital. The hospital pays LifeBank, and then the order is closed. So again, from vendor to request, to matching the request to the inventory, to sending it to the dispatch rider, and to payment system, and then a close of the order. So for us, that's how the process works. It's very seamless and it's very technology driven.
Thank you. Our next question has to do with the NGO model. So the question reads, thank you so much for your presentation and for the work you are doing. Can you say more about how you concluded that a business model would work better than the NGO model? And there's a related question. Could you give, given how many hospitals are in Nigeria that are state-run, what has been your relationship with the government? So those are two separate questions.
Great. So there are a couple of reasons why I decided that the NGO model would not work for LifeBank. The first is that I'm not very good at asking people for money, right? I'm not very good at, saying, please donate to LifeBank and all of that. That was not my best skill, right? That was one, and that was the personal bit. But in terms of the sort of like the operations of the business and the structure of the business, the most important thing was that I did not have, I knew that we needed capital, right? For you to build a distribution business, you need access to significant capital. And I knew that capital would want returns. And that requires somewhat of a business model where you can get some returns and give it to the person who gave you the capital to do the work, right? So for me, that was a stronger model. That was a scalable model, because again, I didn't want to solve a small problem in a small area. I want to solve this problem across the world, right? Across the emerging markets, right? So for me, it was important to me to build a business model that is scalable, right? That is profitable, right? And that can return value to capital. Over. Oh, sorry, second question, which was government hospital. I mentioned earlier that we decided that it was more efficient and more sustainable for us to build our model with private businesses and to be a value-driven business rather than a relationship-driven business, right? Companies that start off with working with governments must build strong relationships with these governments and ensure that relationship lasts so that they can continue operating their business. For me, that was not a model that was appropriate for my personality, to be quite honest. And I felt that it was better for me to build a value-based business, right? Where the reason why we are being paid is not because we have a relationship with a particular institution, is that we're giving value, we're adding value to that institution, right? And for me, the only way to work to do that, right, in a very clean and efficient way is to have relationships with businesses first. But one of the interesting thing and very rewarding thing that's now happened is because we've proven our model with the private sector, right, with businesses, and we're so value driven, governments are now coming to us and asking us to solve the problem for them, right? Because we built technology that is truly transformational for the health sector. We are able to really solve the problems for the governments, and they are coming to us. So rather than us trying to go to them, trying to create this relationship, they are coming to us asking for our services. And I think that's a stronger model that is inherently scalable.
Perfect, thank you. This question is a merge of a question that was already developed in an audience question. But as an African woman doing this type of work, it is imaginable that you've received pushback as a reaction to you being a woman leader, as having a startup, and kind of forging a space where there wasn't one. So what would you say in your experience has been some of the greatest barriers you've faced in running LifeBank?
I think as an African woman, it's, there are many barriers, right? And one of the things about operating in Africa that I found quite surprising when I first moved back to Nigeria was that people would tell you to your face that they don't believe women could lead, right? In the US, there's basically a cost to that. They could think it, they could act on it, but they would never say it out loud, right? They would never say it to your face. And one of the things that was quite shocking and I was taken aback, was when people would tell me, I would never vote for a woman leader. I would never vote for a woman in any position of power in my country. And it wasn't even just like, random leaders in the world. It wasn't just customers. It wasn't investors. It were people in my own business, like my employees, telling me they would never vote for a woman president, right? And not understanding that I'm like, hello, if you say you can't vote for a woman president because she's a woman, then it means that you're telling me that women can't lead. And look at who is the leader in this particular country of LifeBank. So for me, I think it's quite, quite difficult in this particular environment, particularly when it's so emphatic. And I'm not sure which one I prefer, if it's the silent one, like death by a million tiny cuts, or if it's the one that's in your face. But I think it's quite challenging anywhere, right? I think the world is generally misogynistic. And, women just we have to create a critical mass of leaders, women leaders, that would be able to solve these problems across our countries, right? Yeah.
Thank you. You'd mentioned in your presentation that LifeBank has the goal to grow beyond the 3 countries that they're currently working in. And so this question essentially is, what are your plans to grow throughout the continent? And specifically in those plans, what does scaling look like?
Yes, great question. We do have plans to scale, right? We're already in 3 countries. There's still a lot of growth we need to deliver within those 3 countries that we've started operating in, but we still also believe that we should scale to other countries. What we're trying to create is, we want to be a pan-African business first, before we then expand outside the continent. We're looking at, we're already present in West Africa, particularly the English part of West Africa. We are operating in East Africa. We're looking now for the future. You're going to see us in North Africa, in Southern Africa, in Francophone speaking Africa. And for us, once you see us in a couple of countries like that, then you see an expansion outside the continent. But for our growth plan is to look at the regions where we're not currently present and create a presence there, and slowly but surely own the rest of the continent as we continue to grow outside the continent.
Perfect, thank you. And this will be the last question. We've had a couple of audience members ask, how can they contribute and contribute to LifeBank and the mission that you guys have?
Wow, we are looking for you. You know that there's this poster where, like, looking for you poster that you see sometimes. Like, we are looking for you. We need people with a lot of different skills, people with different backgrounds to work with us to scale our company in different ways, either in an employment dynamic or in a consultancy dynamic, or even in a voluntary dynamic, right? So, for me, if you want to give back, if you want to contribute to the work that we do, I ask that you, send me an email. My email is Temie, Temie, @lifebank.ng. I will be more than willing to have a conversation with you about what you can contribute to the future of LifeBank. Thank you.
Thank you so much, Temie. In the interest of time, we'll be wrapping up the conversation for today. And to do so, I would like to end off by thanking you again and your team for collaborating with us, GASO, on this event. We would also like to thank our sponsors, Brown's Global Health Initiative, the Department of Africana Studies, Rights and Reason Theater, the Nelson Center for Entrepreneurship, Sarah Doyle Center for Women and Gender, and the African Initiative at the Watson Institute of International and Public Affairs. Personally, I would like to thank the GASO team for all of their support they've been provided in putting on this event. And lastly, I would like to thank the audience members of the Brown community and beyond for your attendance and participation. For those interested in collaboration with LifeBank, just as Temie said, feel free to reach out to her at the email she just said. I'll restate that for you guys. That's Temie, Temie, @lifebank.ng. We will also be sending a follow-up message with Temie's contact information and a link to today's webinar. And as always, stay tuned for upcoming GASO webinars and other events. Thank you and have a great rest of your day.
Thank you, everyone. Thank you, Nancy. Have a lovely day. Thank you for having me.
Thank you.